Welcome. Today we are going to continue with our learning on Integrative Women's Health Program, specifically in TCM OBGYN relating to anatomy and physiology. You see, traditional Chinese medicine was built on the concept that activity inside of our body really reflects outward or eventually. So therefore, everything that we learn, clinical observations, signs of symptoms, in traditional Chinese medicine tend to focus on this outward reflections. And due to also the taboos in opening and examining the human body, anatomy was not as developed compared to the Western medicine counterpart. So even though there are mistakes as well as generalizations in TCM OBGYN, many of the TCM anatomical and physiological concepts and terminologies are still used extensively today. So as a student and a practitioner of integrated women's health, incorporating TCM OBGYN, it's very important for us to really have a good grasp and understanding of these terminologies. The very first one is 子宫. 子宫 also is translated as house of fetus, or basically is uterus. And there are other many Chinese terms that refers to this name, 子宫, such as 女子包, 包, 子脏, 子处, 包脏, 胎脏, 血脏, and 包宫. So there are many different terms that refer to the same thing as 子宫 in TCM. Now, 子宫's main function, as we know, is mostly in reproduction, and that includes implantation, gestation, labor, delivery, and the process of menstruation. This is a very important organ. In fact, there are some interesting cultural literature in the past saying and alluding something like, when a woman's uterus is strong and healthy, it usually means the woman is strong and healthy. In some ways, it's a way to kind of pick your mate. Not so sure if that's a very good way to pick your mate, but at least that is some of the mythology behind that. Now, 子宫, the proper functioning of 子宫 really require three areas and three, shall we say, proper functioning. One is 天气, and one is 天癸, and one is 冲人. And since 子宫 can both store essence and discharge menses, it possesses the function of both 脏 and 腑. It is therefore considered as extraordinary 腑 organs. Now, let's take a look at some of the relationships 子宫 have with different 脏 organs or even 腑 organs. The very first one, the most intimate and most important one, is the relationship between 子宫 and kidney. Now, both have direct connections via 经络, via the channel and collaterals, and both have direct connections in working together for our reproductive function and processes. Now, 子宫 is connected to kidney, or shall we say kidney is connected to 子宫 via 包络. 包络 means embryonic collaterals. And kidney stores essence, stores gene, and it is a source of reproduction, growth, and development. And as you know, gene is a source for qi, source for blood. So blood is, therefore, extending into it that the blood is the source for menstruation and reproduction. So kidney, as an organ of essence, really plays a major role in the development and productions of blood, of essence, which in turn is the source of menstruation and reproduction. Now let's take a look at 子宫 and the liver. Liver meridian and Ren channel crosses at Ren 2, 曲骨 point, which is just right at our pubic symphysis area. Now, in liver meridian and Du channel also crosses at vertex of the head. Both, as you know, Ren and Du channel, which we'll talk about a little bit later, they both really originate from our pelvis. And in women, it really originates in and from our uterus. Therefore, liver meridian has an indirect impact or indirect connection to the uterus via both Ren and Du channels. Now, if we look at liver, as you know, liver stores blood. It's a master over patency flow of qi and blood. It regulates sea of blood. It has strong influences over the regulation of ovulation, menstruation, and fertility. So liver and 子宫 works intimately in making sure that patency flow process is proper. Then let's take a look at 子宫 and spleen. Spleen meridian and Ren channel crosses at 中极, Ren 3. Ren 3, as you know, is one twin on the mid-sagittal line, just right above Ren 2, just right above the pubic symphysis. Now, as well as scattering at the tongue, when basically Ren channel comes up in the spleen meridian, they meet actually in the tongue area. So the spleen meridian therefore has an indirect connection to 子宫. Now, spleen meridian, as it crosses in Ren 3, and as it connects to the tongue, you know spleen governs the blood. You know it masters over transformation, the source of qi and blood. And it directly regulates menstruation and material nourishment to the fetus. So without spleen, there's no nutrition. Without nutrition, there will not have any blood production. Even if kidney wills it, without that nutrient, you can't have it. So that nutrition is very important, and spleen plays that role, that nutritional role. Now let's take a look at 子宫 and stomach. Very similar in the sense of spleen, but stomach has its own unique influences as well. Stomach meridian and Ren channel crosses at Ren 24, Chenjiang area. Okay, if you look at the slide, you'll see the Chenjiang area just right under your lower lip. Cong channel is composed from parts of the stomach and parts of the kidney. Cong and Ren channel both originates from 子宫. Therefore, there is a direct connection and origination point between the stomach meridian and 子宫. Now, stomach and spleen are connected as Zhang and Hu. They are sister organs. They both are the source of qi and blood. As you know, that stomach is the sea of water and grains. It masters over digestion, while spleen masters over assimilation and absorption. It is a full organ with abundance of qi and blood. When this qi and blood is abundant, then the blood in the Cong channel will be abundant. If that blood is abundant in the Cong channel, the ovulation is going to be strong, the menstruation is going to be strong, and this guaranteeing the proper functioning of 子宫. Now, 子宫 also have relationship with the heart as well, as 子宫 and the heart has actually a direct connection. In the 黄帝素问, he actually talk about how 包脉 originates from the heart, and how the heart directly controls and governs the proper functioning of the uterus. As you know, heart governs spirit, clarity, and blood vessels. The heart directly influences the proper function of the 子宫. So if you look at an expanse on the heart, you recognize conventionally is not just the heart organ. Conventionally, it would be heart and the brain. And as you know, our midbrain, especially with the HPO, the hypothalamus pituitary ovarian axis, you recognize that our midbrain plays a huge and major role in the initiation of ovulation and the proper functioning and proper regulation of the menstruation. Therefore, obviously, the heart has a very strong connection to 子宫. Now, let's talk about 子宫and the lung. Now, 子宫and the lung have indirect connections. Lung meridians enters the lung, while the smaller collaterals spread into the throat. This is where the collaterals of the lung meridian meets the Ren channel at the throat, as well as the kidney channel. Ren channel originates from, as you know, 子宫in pelvis, and the lung masters over the distribution and transportation of fluid, of gene, and blood. So lung is very important in helping 子宫 to have proper function because of its distribution act, in the way it distributes the fluid, the way it distributes the essence and the blood as well. Let's talk about 包脉 and 包肉. Now, 包脉 and 包肉 are channels and collaterals that connects to the 子宫. Now, the main function is to provide nourishment. It's a conduit. It's a vessel that kind of transport nourishment to the 子宫, such as essence, such as qi, such as blood, to make sure 子宫 is functioning properly. And Huang Di Suwen have said very clearly that when there is cessation in menstruation, when the menstruation stops, it is frequently due to the blockage in the 包脉, blockage in this 包 channel. And 包脉 is governed by the heart. And as I said earlier, it has direct connection from the heart to the 子宫. So if there is a qi blockage in the lung, for example, this can, for example, sadness, some emotional sadness, melancholy. This can affect the heart, causing blockage in the 包脉, interfering with the proper functioning of menstruation. So this is when frequently you might have patients that come in, have very strong sadness, melancholy, or a sudden loss of their mother or sudden loss of somebody important to the person. All of a sudden, you can see the cessation of the menstruation. And this is the explanation for it. The reality is that in any situation where there's any change in blood flow in the body, it can all have the potential to affect the menstruation. Huang Di Suwen also say that 包肉 connects directly to the kidneys. And since kidney in TCM denotes the reproductive system, 包肉 therefore is the connection between all the other reproductive system to 子宫. It's kind of like the tentacles to all the other areas. 冲, ren, du channels all have origination from 子宫, and therefore they are considered a big part of this 包脉 and 包络 system. So let's look at 冲 channel, 冲脉, or we call it penetrating channel. Penetrating channel is also called the Sea of 12 Meridians and the Sea of Blood. Origination, penetrating channel mainly runs longitudinally to as high as the head, to as low as the bottom of the foot. It has direct and indirect connections to almost all 12 meridians. Sometimes this term 冲 penetrating can also be translated into critical or important. Why is critical important? Because it regulates all 12 regular meridians, because it crosses all of them. It connects all of them in one way or the other. It runs throughout the entire body, governs the flow and nourishment of qi and blood to all the meridians. Therefore, it's frequently again called the Sea of 12 Meridians. This channel has known to have 3 distinct origination points or areas. 1, it begins just below the kidneys, along with collaterals from the kidney meridian. It's nourished by the essence from the kidneys. So that's one area, just right below the kidneys, and is kidney dominant. 2 is it begins in the greater pelvis area. So in the pelvis area, it's not focused on 子宫, but anywhere in the pelvis area. That is the second origination point. The third origination point is that it begins actually in the 子宫 itself, especially in gynecology, in women's situation. It begins at the 子宫, full, extraordinary organ. It regulates, the 冲 channel regulates menstrual blood flow. Therefore, frequently we call this 冲 channel as the sea of blood. And it also meets qi cong, meets at qi cong stomach 30, this point, with the stomach channel, where that the stomach channel provides this strong, as you know, the Yangming channel, stomach channel is abundance in qi and blood. Without abundance of qi and blood, it flows right into the 冲 channel, where the 冲 channel flows right into the 子宫 to help to replenish and allow the ovulation and menstrual process to take place properly in the uterus. Now, 冲 channel has a few branches. In fact, since it goes all over the place in the body, it's actually quite complicated, and it encompasses 5 major branches. The first branch, I call it the main branch, originates from 子宫 area, down in the pelvis area, and it tracks the Ren channel downward to the surface at the perineum, Hui Yin, which is Ren 1, and it then travels bilaterally to meet the stomach meridian at qi cong point, just right above the inguinal area. Qi cong is stomach 30. That's around 5 trin below the belly button and 2 trin lateral to the mid-sagittal 9. Then it continues to run upward, tracking the kidney channel, which is just very close, parallel to the Ren channel, upward, and it meets all your kidney points, the Henggu kidney 11, Da He at kidney 12, Qi Xue at kidney 13, and Siman at kidney 14, and then Zhongzhu at kidney 15. So it meets all these points as it comes up. And then it converges at Ren 7, Yin Jiao point. That's when the energy comes together again. And from that point, from the Yin Jiao point, then again it runs bilateral upward again, and again meeting these kidney channel points again. Huangsu, kidney 16, Sanqu, kidney 17, Siguan, kidney 18, and then Yindu, kidney 19, and Tonggu, kidney 20. And now the last one, Youmen, kidney 21 points. After meeting all these kidney points just right below the xiphoid process, below the rib cages, it now start to moving upward to disperse in the chest region. So this is the main channel, the main branch. Then the next one is the second one is the extended upper branch, which continues from the chest region and runs upward through the throat and circle around the lips and terminates at the upper throat and the sinus region, just right behind this, called Gangsang in Chinese. This permeates into the yang meridians of the face, head region, and nourish them with yin and blood. So this is where that if you have enough qi and blood from the Cong channel to nourish all the yang channel of the face, then you won't have withering. That's the reason why later on when you read in Su Wen, at 35-year-old, your face start to wither. This is where the problem, the Cong channel is not having enough qi and blood at this point. The third branch is the posterior branch of the Cong Mai. The posterior branch basically runs just like the Du channel. Okay? It originates when the pelvis, running backward to the spine. It tracks inside the spine upward like a Du channel, and most likely end at where the Du channel terminates. Truly, there is no termination point discussed in all the classics where really this branch terminates. I would presume that it takes on the energy of the Du channel, and it moves and tracks just like the Du channel. The fourth and the fifth branch is what we call the lower branch of the Cong Mai. Basically, this is where the meridian, the channels start to move downward. The lower branch originates, again, just below the kidney, meeting at Qi Cong stomach 30 point, and runs downward along the medial aspect of the thigh into the popliteal fossa. From there, it then transverses to the medial margin of tibia, downward to the posterior aspects of medial malleolus, basically your ankle bone, and terminates at the bottom of your foot. Now, that's one of the lower branch. The other lower branch offshoots from the lower medial border of the medial malleolus, which is from your ankle. Now, this time, instead of traveling to the bottom of foot, now it travels to meet the big toe, to meet with the foot Jue Yin liver meridian. So as you can see, the Cong Mai really has a lot of connections. And these two lower branches permeate and warm the yin meridian of the foot, mainly the liver, the spleen, and the kidney meridians. So that's about the function of Cong Mai. Cong means important or critical, as I said earlier. It is a critical channel because it governs qi and blood flow of all regular 12 meridians. Therefore, it's frequently called the Sea of 12 meridians, or the Sea of blood, 血海. Penetrating channel connects directly with both Ren, Du channels. It further regulates all yin, blood, and yang qi of the body. Cong Mai again connects with kidney and stomach meridians, which supply jin and blood to Zigong to allow regular ovulation and menstrual process. Therefore, if Cong Mai is weakened, it affects the body tremendously in so many ways. First of all, the period will weaken, the period will stop. And it can affect the youthfulness of your body as well. So in women, really focusing on treating Cong Mai, it's very important in provide good health and the consideration of longevity. Let's go to the next vessel, the conception channel, or what we call Ren Mai. Now, conception channel encompasses 3 branches. The main branch originates from Zigong, moving downward to the surface of Huiyin Ren 1. This is just like the Cong channel. Moving upward, tracking the mid-sagittal line through the throat and winds around the mouth and terminates into both eyes. That is your main branch of the Ren channel, okay? And the second branch, just like the posterior branch of the Cong channel, it originates from Zigong again, moving backward to the spine, then moving upward inside the spinal cord, tracking the Du channel, just like what the Cong channel did, terminates, but this time terminates around the mouth region, just like its main branch, terminates around the mouth region and the eye region. The third branch is actually a collateral branch. It's a low channel of the Ren channel, which begins at the xiphoid process, spreading downward into the epigastric region. So that's the reason why if there are abdominal fullness, if there are indigestion in epigastric regions, treatment of balancing the Ren mind, Ren channel, conception channel, can be very helpful in treating of that particular condition. Let's talk about the function. Ren means supporting and nourishing. The channel traverses through the in portion of body. It's all in this area. This is the in portion of body. It governs all the in channels. And no wonder we frequently call this channel the sea of in channel, the sea of in channels. Ren channel begins in Zigong, begins in Zigong, and therefore it governs over gestation. So its responsibility is to ensure a proper pregnancy all the way until delivery. So most conditions of a Ren channel, including but not limited to hernia, vaginal infections, irregular menstruations, infertility, dysuria, incontinence, and conditions of the genitals. Condition of the genitals. Let's talk about Du channel, Du Mai. As you know, Du Mai is basically our spinal cord, and it originates at the pelvis. In men, it's pelvis. In a woman, most likely it's Zigong. It descends downward to the genitals. So in a woman, it actually descends down to the vaginal meatus. So the opening of the urethra and the opening of the vagina area, that's where it surfaces. Then it tracks backward through the perineum area to touching the Ren 1 point. And then it enters the spine and rising upward to the top, the vertex of the head. Then it then descends downward through the front of a face on the midline and terminates at the tip of the nose and filtrum. So this is where it ends. Some people in some writings consider the termination point is in the upper palate, right inside. So it's not just on the surface, it's a little bit inward. Now, another branch of Du Mai, governing channel, arises from pelvis, basically track the Ren channel upward, going around the lips and ending up in the middle of the eye. So you can see both Ren and Du channels are somehow connected together. They're really sister channels. They somehow tracks each other's, their branches track each other's main channel. Now this channel has very strong connection with the Ren channel, as I said earlier, and also most other regular channels, especially the yang meridian, since it's running in the back and it connects all the different yang meridians. And it governs all the chi flow of these yang meridians of the body. Therefore, it's frequently called the sea of yang meridians or yang channels. It regulates and have more intimate relationship with all the regular yang channels. And it has a very strong regulating function for the brain development, for the brain function, as well as bone marrows. The last channel I want to talk about in TCM OBGYN, and it does not mean the other channels such as Yang Qiao, Yin Qiao, Yin Wei, Yang Wei. It's not important. They just have less to do with TCM OBGYN compared to these 4 channels. So let's go to the belt channel, the Dai Mai. Well, belt channel is basically like your bell. I think we all learned this in our schooling. That it runs horizontally, crossing the top of hip bone to the abdomen. It really originates around liver 13 area and move forward to meet gallbladder 26 Dai Mai, and then continue gallbladder 28 Wei Dao, and then Wu Su gallbladder 27, and then it terminates in the level and terminates in the umbilicus area. Now, another branch of the belt channel runs from Daimai, gallbladder 26, backward and upward to meet bladder 23, Sensu point, and terminates at L2 spine region, L2 spine region. And Daimai, its main function is to control and to regulate all the longitudinal channel of the body. And the condition of Daimai can include, but not limited to, abdominal pain, back pain, vaginal infection, and lower limb atrophies. So as an overview, 冲, ren, du, dai, these four extraordinary channels has direct connection to each other. They affect each other strongly, especially in OBGYN conditions. They regulate many of the body's function in women. They specifically regulate over reproduction, gestation, and lactation. And Chongmai provides qi and blood nourishment to the reproductive organs. It regulates the proper functioning of ovaries and uterus, while Renmai dominates over gestation. It regulates and is responsible for proper growth and development of the baby. And Daimai governs over the flow of qi and blood to the reproductive system. It's a belt channel. It also regulates over fluid, moving of a fluid metabolism, and strengthens the immunity and fights infection, especially vaginal infections. Du-mai governs the Mingmen, the gate of life, of yang functions. It regulates hormones and endocrine system and the HPO, hypothalamus, pituitary, ovarian axis. So each one of them supports each other, and each one of them has specific function as well as general functions. Now let's take a look at other terminologies here. Okay, 子门 is fetal gate. It's the opening to the uterus, commonly known as the cervix. 阴道 is inway. This is where the influence, menstruation, where the sperm travels and fetus is being born. It's the vagina. 直肠, it's fetal, it's translated, it's called fetal intestines. Well, it's basically a combination of 子宫 and vagina. Then you have 阴门 or 肠门, means vaginal opening. 阴腹 means female external genitalia. 阴气 just means external genitalia. So these terms you will see sprinkle out through different classics of TCM OBGYN. It's important for you to understand some of these terms in a historical perspective so that when you go back and do some research or study, you will not be surprised by them. Now we're going to now go into TCM OBGYN. Okay, we're going to take a look at Zhang Hu, how that relates to TCM OBGYN. Now, the uniqueness of TCM OBGYN is that in women, the body is dominated by blood, led by qi, and is nourished by yin and fortified by yang. It has, the body has unique physiological processes of menstruation, pregnancy, labor, and breastfeeding, or we call lactation. Monthly menstrual cycles corresponds to the rising and falls of tide of yin and yang. So this is the uniqueness of a woman. Now, kidney, we talked about earlier, stores essence. Essence or jin transforms to qi. Jin and qi are the source yang and yin respectively. It is also commonly named as kidney yin and kidney yang. It is the source of yin and yang of the entire body. Kidney is also the source of tiankui, the heavenly water. It is the foundation of Cong and Ren channel, dominates over reproduction, body fluid, connects with the brain. Liver and kidney shares the same foundational essence source. And while spleen and kidney nourish each other. and lung and kidney governs together the qi flow in the channel. So therefore, kidney, it's a very important organ. It's a source of essence, source of qi, source of qi and the blood. It is also known to be the foundation for growth, development, and reproduction. Now, kidney also secretes and develops tiankui. Tiankui can only be secreted when there's abundance of kidney qi and the balance between kidney yin and yang. Only when there is an abundance of kidney qi can the Cong and Ren channel begin to properly fill up the sea of blood and be functional. When Cong channel and when Ren channel is abundant, ovulation and menstruation can occur regularly. Therefore, kidney zang is probably the most important organ in TCN OBGYN study. Liver, let's talk about liver. Liver stores blood and masters over patency of flow. Liver blood not only nourishes the body, it also fills the sea of blood, the 血海, where the sea of blood provides the foundation for menstruation. Liver channel runs around the external genitalia, the stomach, the pelvic, the breast, and the top of the head, provides nourishment and regulation to growth of external genitalia, hair, for example, proper development of menstruation, and also breast milk production. So liver is an important organ. Now let's move on to spleen and stomach. Spleen is the source of qi and blood, transforming full essence. The proper functioning of ovulation, menstruation, gestation, and lactation all depends on normal functioning of spleen. You can say spleen and stomach brings the nutrition to the table. Stomach is a full organ with abundance of qi and blood. Stomach channel and Cong channel meets in the pelvis where the stomach provides the blood and the qi to the Cong channel, while the stomach channel also provides direct nourishment to the breast. Therefore, the production of breast milk is directly related to the strength of the stomach. Okay, again, the production of breast milk is directly related to the strength of stomach. Now, both ovulation and menstruation and lactation process require the nourishment from spleen and stomach. Without it, a lot of time we would have cessation of the period menstruation. Earlier we talked about the heart. Let's go into the heart. The heart masters over the blood and has direct connection to Baomai and Zigong. It ensures that Baomai is functioning properly, which affects the proper ovulation and menstruation. We know that heart dominates over spirit, or we call Sen, and connects with kidney. Along with kidney, they regulate both spirit and essence of the body. Heart is important. It's not just a governor. It's actually a director, it's a leader, it's a dictator that dictates whether or not actually a menstruation is going to be happening or not. Now lung, let's go to lung. Now lung masters over qi, over the transformation and transportation of qi throughout the body. Lung also dominates over waterways of the body, making sure that fluids are well distributed throughout the body. Lung also has the function of ensuring qi flow in all channels and collaterals are proper. And this proper flow and abundance of qi affects female physiology, female physiological function of menstruation, gestation, and lactation. So, if we look at the woman's reproductive physiology, we can trace back as far back as in the Huangdi age, in the book of the Yellow Emperors, written about, some people say it's about 5,000 years ago. Some people say it's about 4,000 years ago, which discusses the development and the growth and decline of female life in 7-year cycles. For men, is 8-year cycles. So Su Wen starts in chapter 1. Chapter 1, just to give you some idea, the importance of reproductive endocrinology in Chinese medicine. It states like this: Huan Di asked, when one grows old, one cannot have children. Is it because one's energy has already been exhausted, or due to a natural environment? And Qi Bo replies, starting to reply all the differentiations of 7-year cycle. So he talked about the 7-year cycle, the 14-year, the 21, the 28, the 35, 42, and 49. So it starts with the 7-year cycle, the 7 years old. Qi Bo replies, say, for a girl, her kidney qi, her kidney energy becomes prosperous when she's 7. And as kidneys determines the condition of the bones and the teeth, and which the teeth is the surplus of bones. So therefore, in this situation, when her kidney energy is so abundant, her milk teeth or her first teeth, her baby teeth, falls out. And then the permanent teeth emerges when her kidney energy becomes really strong. It becomes prosperous at this 7 years old time. And as you know, the hair is an extension of blood. Therefore, the blood is transformed from the kidney essence. Her hair will start to grow in a more rapid rate when the kidney is prosperous. And this is happening at around 7 years old. So we call that 7 times 1 cycle. Now let's go to the 7 times 2, which is 14 years old. That this time, her tiankui, or what we call heavenly water, appears at the age of 14. Now at this time, her renmai, her conception channel, begins to put through, and her congmai, her penetrating channel, becomes prosperous, and her menstruation begins to appear. As all her physiological condition becoming mature, she can now be pregnant and bear a child. Now, if you can imagine, this is written somewhere around 3,000 to 4,000 years ago. My God, their time of menarche has not changed too much. I mean, in this day and age in the United States, I think the last time I checked, the average mean age is about 12.8, 12.9. So 14 years old might be a little bit late, but it's not much earlier today. So in some way, this concept still applies quite well, even in this day and age. Let's go to 7 times 3, 21 years old. At 21 years of age, the growth of kidney energy reaches the normal status of an adult by the age of 21. Her wisdom teeth starting to show and have grown up by this stage, and her teeth are completely developed. So her kidney energy is becoming very abundant, very abundant. And that brings us to 7 times 4, 28 years old. Because at 28 years old, this is when the peak kidney energy exists or occurs. In reality, if you look in reproduction, actually 28 years old, frequently, it is still very prime age of fertility, but it's not exactly the peak anymore. In fact, I would say somewhere around 24, 25 is actually the peak more. 28, 29 is actually start to decline a little bit. But nevertheless, 28 years old, at 4 times 7, her vital energy and blood becomes substantial. Her extremities become strong. The development of tissues and hair of her whole body are flourishing. In this stage, her body is in the strongest condition. Now, if we talk about 7 times 5 is 35 years old, that's the next stage. At 35, your fertility, your reproductive function is starting to decline a little bit, actually quite a bit. The physics of the woman turns gradually from prosperity to decline. So by this time, her Cong channel is starting to decline a little bit. And we talked about that earlier before, that the Cong channel supplies the gene and the blood to the yang channel of the face. So her Yang-Ming channel turns to debility, where her face is starting to become withered. They're starting to have wrinkles. There's a little bit lines here and there. May not be so severe, but you start to see that. And her hair begins to fall just a little bit more. That brings us to 7 times 6, 42 years old. By the time when a woman reaches 42 years old, her 3 yang channels of the face or even the body, the Taiyang, the Yang-Ming, and the Shaoyang channel all begins to decline. So her facial complexion becomes waning. And what we will be seeing is a lot more lines and wrinkles. And her hair begins, you start to see some graying in a woman. Nowadays, you don't see much graying because most women dye their hair. So you can't really tell, but you got to ask them. And they will tell you when they start having graying. Now, if you look at this chart over here, you will find that the fecundity rate by age really changes drastically through time. You can see the peak is between 20 to 24 years old. And it gradually declines. But between 40 to 50-year-old, it's a very dramatic drop. Very dramatic drop. So if we are counseling, advising a patient to get pregnant, we really want to see if they can get pregnant before the age of 30, if it's possible. And also, women need to be counseled in a sense to understand what's their fertility rates going to be when they're passing 30-year-old, when they get to 35, when they get to 40, when they get to 45. So these are some of the age times where they really need to see. Now the last, the last 7 times 7 is 49 years old. At the age of 49, her Ren and Cong channels are depleting, and her menstruation really ceases as the Tiankui being exhausted, and her physical body turns old and feeble, and she can no longer conceive. This is menopause time. So in the old days, the mean age of menopause is 49, but today, with nutrition, with a good nutrition, we can see that menopausal time is advancing a little bit to somewhere around 51 years old. So there is a little increase, but I think that's due to the nutritional status. That's really quite helpful, So in general, as an overview, summary, blood is the basis for women, qi for the man. And during the reproductive years, there is a superabundance of qi and blood. At the same time, blood is monthly released via menstruation. Or during a possible pregnancy, it nourishes the fetus, and after birth, it's transformed into breast milk. So the blood transforms into breast milk. And through time, blood is slowly decreasing. And since the Yang-Ming channel is abundant with qi and blood, it will be the first one to exhibit any kind of signs of decline. It's very sensitive. That's when you start to see on the face and the hair first. Slowly starting at age 35, the onset of premenopause, you can actually see some of it. At age 42, you can definitely see some perimenopause starting. And age 49 is the average menopause arrives. Okay, so in the next lecture, we'll get into more aspects of the physiology, especially in reproduction. So we'll stop here today, and looking forward to share more of my experience in our next lecture, continue onward in the TCM OBGYN physiology. Thank you very much.